Hi, everybody. Welcome back to day 2 of our environmental medicine webinar series. I'm Stacy Malashevsky, and I'm honored to be your host again today. Yesterday, we kind of laid the groundwork by identifying the most common airborne toxins and where they're showing up in patients' daily lives, from homes to workplaces. We identified the big top 5, as we called them. Today, we're going to go even deeper. Today, we're going to talk about how these pollutants actually disrupt immune regulation and what clinicians need to understand about the connection between exposure, immune suppression, and autoimmune activation. So, to begin, I want to just kind of lay out the mechanisms. Maybe Dr. Fine, from your clinical and research perspective, how do these pollutants like microplastics, PM, dioxins, formaldehyde, and benzene, how do they interfere with immune function at a cellular and systemic level?
Okay, let's start with microplastics. In terms of microplastics, the research is still coming on board in human beings, but the animal studies research suggests that they affect both B and T cells in the immune system, potentially disrupting immune function, and they also affect the macrophages. They can spew out pro-inflammatory cytokines. They are known for creating reactive oxygen species, so a lot of free radical damage, which leads to the production of something called DAMPs, danger-associated molecular patterns. And these, of course, interfere with toll-like receptors, cytokine responses in the immune cells. But the thing about plastics that I also want to mention and emphasize is that when you're talking about plastics, you're not just talking about the plastic bit, because that's what everyone thinks about. Well, I have a little bit of plastic in my gut, and surely it's just going to come right out. It's going to be in and out. But the microplastics can act like a Trojan horse because they have this ability to adsorb toxins in the environment, like polycyclic aromatic hydrocarbons, PM 2.5, heavy metals, biological biofilms, and they are also made up of a surprising number of other chemicals like BPA. So once these microplastics are in the body, we have to also consider that they are desorbing all these undesirable pollutants that they picked up along the way, and those chemicals have their own effects on the immune system. So that's the problem with microplastics. But what is coming on board now, very recently, is that they're suspecting that microplastics is involved in cancer, and they're looking at early onset colorectal cancer as maybe being influenced by the microplastics. They've looked at colon cancer tumors, and they've looked at the content of microplastics in them as compared to adjacent tissue, and found more microplastics in the tumor tissue. And so there are some known pathways that microplastics go through that are affecting cancer pathways. And it's not just the GI cancer, it's also lung cancer. Think about it. Remember, I began in our first webinar, I talked about indoor air being a huge source of microplastics. Well, those microplastics that are being breathed in are going to your lungs. And so there's some inquiry into microplastics and lung cancer as well. And then the other thing I want to mention before we leave microplastics is that BPA is a big part of plastics. And BPA is kind of known for having the ability to influence autoimmunity. There's several published studies on that. And the most common autoimmune diseases like lupus and MS and rheumatoid arthritis and Graves' disease and psoriasis and type 1 diabetes. There are some research studies already looking at BPA and its ability to affect those processes.
Okay. Do you see a difference in how acute versus chronic exposure affects immune outcomes?
Not in microplastics, no. I haven't seen that at all. They're not really aware of breathing in microplastics or eating microplastic. You can't see them.
Ongoing, yeah.
It's really more ongoing, and then the damage accumulates.
Okay. So I'd like to kind of get into immunosuppression. Let's maybe start there when we're talking about, the first pattern that we see in immune dysregulation, immune suppression. Can you share how, you've seen these top 5 pollutants contribute to immune deficiency, even increased cancer susceptibility? I mean, maybe we start with dioxins because if I'm not mistaken, they are one of the biggest immune suppressors. Correct.
Yeah, they are. I think that's a good place to start, but I really don't want to miss the opportunity to talk about PM 2.5 and the risk of severe COVID-19. One of the greatest examples of PM 2.5 and immune system suppression is really the COVID pandemic, where studies show that for every 1 microgram per cubic meter increase in PM 2.5, there was an 18% increase in the risk of hospitalization for COVID-19. And I want to use, by way of comparison, I want to use the Los Angeles fires that we just recently had. The peak reading in the LA fires for PM 2.5 was 400 micrograms per cubic meter. The average reading is around 35. And so if you do the math on that, the increase, if COVID was still going on, the increased risk of hospitalization would have been about 65 times that of background levels of the PM 2.5. So that gives you some idea of PM 2.5 and its ability to, bring down the immune system. But getting into dioxins, one of the most potently immunosuppressive chemicals known as dioxins, and they're involved in thymic involution. Your thymus is an immune organ. It has been known to decrease host resistance to pathogens and tumors, and it suppresses fetal lymphocyte development and maturation. It suppresses adaptive immune responses, including antibody production. And there are delayed hypersensitivity responses. And there's quite a bit in the literature on dioxins and cancer. I have some really good slides in there on the kind of cancers that are associated with dioxins, but also I want to talk about dioxins are also hit the liver pretty hard too, including liver cancer. And they have been shown to contribute to liver fibrosis and progress towards NAFLD, cirrhosis, and cancer. So that's really important to know about dioxins and immunosuppression.
Are you seeing patterns of like reactivated viruses like Epstein-Barr or poor vaccine response in patients that have this like high toxic load with these solvents?
There are chemicals linked to reduce vaccine effectiveness, like PCBs, which we did not talk about, but dioxins is one of them. Lead is one of them. Mercury is one of them. Hair mercury exceeding 1.2 micrograms per gram in older children were associated with a 73 point higher odds of becoming a non-responder against measles vaccine, which measles is very much in the news today. So I would say that looking at reduced vaccine effectiveness due to people's environmental load of toxins would be a really good thing to look at, because the reason why people are getting vaccines is to prevent a disease. And if they're not even able to respond appropriately, that should let us know that that's a problem too.
Earlier in the show, yesterday we talked about benzene too, and that's another big immune suppressor. Tell us how this relates to that, and especially cancer susceptibility.
Well, benzene, like I mentioned before, is a class 1, meaning acknowledged and accepted as a human carcinogen. So, and we've known this for a very long time because of benzene's ability to directly affect the bone marrow, which is where all of our blood cells come from, our red and white blood cells, right? So the damage that goes directly into the bone marrow can cause 2 specific cancers we know, acute leukemia, acute myeloid leukemia, and non-Hodgkin's lymphoma. So we know directly it's causative for those 2 bone marrow derived cancers, blood cancers. The other very concerning effect of benzene is that it lowers the number of white blood cells. So, as environmental medicine doctors, when we have patients who are experiencing low white counts, especially low white and red counts, we always make sure that they're not either occupationally or non-occupationally exposed to solvents, specifically to benzene. Now, as far as the increased risk for infection goes, the problem with both formaldehyde and benzene, and I'll talk about formaldehyde later, is that benzene decreases very specific subclasses of white cells called CD4 T cells, B cells, where our antibodies come from, and natural killer cells. And so this symphony of both T and B cells are absolutely necessary to be able to go after infectious agents, to remember what they look like and to go after them. The other concerning effect of benzene is that it impairs macrophage activity directly. And macrophages are the cleanup crew of the body, right? If you've got an infection or you're even trying to get rid of, let's say, for example, you're trying to get rid of microplastics. What does that? Well, the macrophages go in and literally surround, the neutrophils go in and spit enzymes at them and kill them. And then the macrophage is the cleanup crew that goes in and surrounds that foreign body and takes it out into the lymphatic system to get rid of it. If you don't have efficient macrophage activity, that causes all kinds of havoc in the body that ends up as chronic inflammation. And we know that chronic inflammation is a huge contributor to chronic disease. And in fact, some doctors even think that chronic inflammation causes disease, chronic disease, and some acute diseases, including cancer, including autoimmune disease, including cardiovascular disease. So those direct ways that benzene and formaldehyde will damage the immune system, and specifically those cells, those cell types, are really the perfect storm for other problems.
Okay. I'd like to switch gears just a little bit and talk about labs and patterns, how clinicians can spot immune suppression in patients.
Yeah.
What biomarkers or clinical clues kind of tip you off that a patient is experiencing pollutant-induced immune suppression?
So I just talked about them. So
yeah.
Commonly, when you go in for a physical every year, you get a chem panel, a
Yep.
CMP, and a CBC. And the CBC is broken down into red and white cells. And basically, you can see your total white count and your lymphocytes, neutrophils, etc.
That's where you would start.
So that's where you would start, is to look at that. Now, if you can imagine that those solvents are actually doing direct damage in the bone marrow, where the progenitors or the precursors to our white cells and our red cells come from, those cells, those progenitor cells, are called granulocytes, and you can test for those. You can see those on a CBC. And sometimes one of the first signs of damage from solvents are those promyelocytic cells, like the granulocytes. Those percentages, those populations will go down.
Okay.
Sometimes in an acute situation, when you've got somebody who's occupationally exposed, like somebody who, I've had patients who work in auto repair shops and literally wash their hands in solvents, their complete red cells, their white cells, their platelets will all crash because their bone marrow is being so damaged by the exposure to that solvent that goes in through their skin. They breathe it into their lungs. It goes into their systemic circulation, ends up in their bone marrow.
So how can...
Oh, thank you. I didn't answer the question. Okay, so from a clinical perspective, there are several things you can do, but there's a test called a lymphocyte map.
That's where I was going.
Again, the lymphocyte map is a certain lymphocyte cell subset that you can get done by the particular laboratory that has coined that term, the lymphocyte map. And you can see within the lymphocyte map decreases particularly in natural killer cells, particularly in CD4 cells, particularly in CD8 cells. And that really, there is a picture that you can see that is a solvent toxicity picture. Now,
and so that can help distinguish immune suppression from toxic exposures versus something like COVID, mold, Lyme.
Well, if you want to do a differential with Lyme and mold, then there's a wonderful researcher named Dr. Bruce Patterson who has created a laboratory called InCellDx testing. That's not the name of the laboratory, that's the name of the test, where he's looking at cytokines and RANTES. He's actually able, I just saw a presentation, amazing presentation he just did in a conference a couple of months ago, where he actually now has a very clear differential between Lyme, mold, long COVID, and toxicant exposure. So tests like that are very clear, well-researched, good evidence, clinically available.
And then with the solvents, you look at the lymphocyte map and the subsets. And
correct, yes. You can't really see solvents. I want to be clear. I think I just misspoke, so forgive me. With the solvents, you've got to do a lymphocyte map. For the other differentials, the InCellDx test is really helpful. Sometimes you can see long COVID in other tests, but the research shows for the InCellDx that you can differentiate between between Lyme and mold and COVID and long COVID and vaccine injury.
Okay.
So thank God we have that test.
Yeah, for real. If we could just switch gears again and maybe look at the other side of the immune spectrum, autoimmunity, the triggering of autoimmune activation. How do pollutants, like the top 5 that we've been talking about here, play a role in the initiation or amplification of autoimmunity?
I will talk about formaldehyde, but I really want Dr. Fine to talk about bisphenol A, because the research is so compelling.
Okay. Do you want me to start then?
Yes, please.
Okay. Well, bisphenol A is it's one of the top toxins out there. It's like the flag bearer for all toxins out there. It has so many different effects. Studies even show it increases all-cause mortality, which means death from any cause. So it really has the ability to be way more than just an endocrine disruptor. It's been shown to contribute to cancer. There's a lot of research behind it for being a cause of autoimmune disease. And that's
diabetes.
And diabetes as well. And there's twin epidemics of, diabetes and obesity. BPA is probably the poster child for obesogens, which is a chemical that causes obesity. And it's anymore You can't blame obesity and diabetes on people's diets exclusively. Their diets can play a role. But another thing clinicians don't understand, we have this incredible rise of GLP-1 agonists because people are obese and diabetic and they are having so much trouble dropping the weight and getting good control over the diabetes because no one's looking at their toxic load of things that contribute to diabetes and obesity, like BPA, like arsenic, like mercury, right? And so there are chemicals, we are now being exposed to chemicals in our environment that are pushing obesity and diabetes. And what does the conventional world and even the integrative world want to do is treat it with drugs again, instead of getting to the root cause, which is looking at the levels of the inducing chemical substances like BPA. So BPA is something that is definitely going to push autoimmunity in the body and other things as well. So that's the story on BPA.
And Anne-Marie, correct me if I'm wrong, but I believe now that Cyrex offers an autoimmune panel where you can actually look at antibodies that are directed towards BPA.
Yes, I believe they do too. I believe they do. Yeah. Yeah. So you can see that directly.
Okay. So we can switch to formaldehyde. When it comes to things like formaldehyde, Dr. Patrick, the chemical intolerance isn't necessarily always, IgG, correct?
Correct. And in fact, let me say this about formaldehyde. It is probably one of the most common exposures that leads to sensitization of the immune system. So when we say that sensitization, what we're talking about is a reaction that can occur through many different pathways and many different mechanisms that then when the person is re-exposed to the formaldehyde, the body reacts. And it could be anything from the common known reactivity to formaldehyde, like itching, burning, watery eyes, sore throat, runny nose, cough, skin irritation, rashes, dizziness, nausea, headaches, to serious autoimmune disease. Now, formaldehyde also suppresses the immune system. So all the things, almost all of those effects that I talked about for benzene, like suppressing natural killer cells and other T lymphocytes, apply for formaldehyde, but formaldehyde is very different in that it can initiate a whole variety of autoimmune conditions. And I think, especially because healthcare providers love patient cases and everybody else loves stories, I want to tell a story about a patient who reacted to formaldehyde. And this is very important because it involves what Dr. Fine's going to talk about in a few minutes, which is hair straightening products. So these are things that could be found in the home that are labeled quote unquote formaldehyde free, but really are not formaldehyde free. So I'm going to teach you about autoimmunity and formaldehyde with this patient case. So this was a patient in September of 2010. And this is in the slides as well, if you want to look up the paper. This is actually a published case. 47-year-old woman who had a history of being completely healthy. She had been given a complete physical and blood work. She was being cleared for IVF treatment several years before, so she had no clinical diagnosis, but she had had a reaction to some sutures that contained formaldehyde. So she had some redness and swelling from those sutures. And she was told, well, it was probably from the formaldehyde in the stitches. So she knew that she had a pre-existing problem with formaldehyde. Now she went to the salon and wanted to get some hair straightening, and it was kind of like a Brazilian blowout. Her salon worker said, don't worry, this solution is actually labeled formaldehyde free. So there's no formaldehyde in it. So it was applied to her hair, followed by blow drying and then heating with a curling iron at about 450 degrees. And that's important because we're going to find out later what happens when you use the formaldehyde-free solution and heat. So the procedure usually is to wash the chemical out after the treatment, right? But it was near closing time. She was told, leave the solution in until her next appointment and they would wash it out. Over the next few days, she developed diarrhea, vomiting, her whole body turned red and got hot, and she got a low-grade fever. A week after the exposure, she felt a burning sensation on her scalp, and so she washed her hair that day. While she was in the shower, hot shower, temperature about 100 degrees, she started having difficulty breathing. And she smelled fumes coming off of her head like someone was using a lot of spray bottles full of some kind of chemical. Shortly afterwards, she experienced the onset of recurrent nosebleeds that continued for months. At that point, she realized something bad was happening. She went to the emergency room. The physician told her that she actually had bald spots and sores on her head, consistent with what looked like a chemical burn on her scalp and lesions in her mouth that were sore. In the ensuing 3 months, she lost 25 pounds because she couldn't eat. She had nausea, bloating, severe abdominal pain, which ended up with constipation. She only had a bowel movement every 2 to 3 weeks, and finally was diagnosed with pancreatitis and had daily episodes of tachycardia. Her heart was beating really fast, and she had full body numbness and tingling. Now, 76 days later, so 2.5 months later, she went in. An industrial hygienist, like a toxicologist, actually measured the formaldehyde levels next to her hair with a heat application. So they heated the hair up, put an air probe next to her head to capture what was coming off. And she had formaldehyde levels of 150 parts per billion. Now, to make that relevant, the level you are allowed in occupational in an industrial setting for California's EPA is 44 parts per billion, so less than a third of that. And that's only for an hour. You can't be exposed to that for any longer than an hour. This woman was exposed to that anytime she took a hot shower or heated up her hair. She had to have her head shaved to get rid of that toxic burden. The solution that she got a hold of the solution that was used in the hair salon. It had about 8% formaldehyde equivalent by weight. And remember, there was a label on this solution that said formaldehyde free. So that's almost 13, 14, 15% methylene glycol, which is another word for formaldehyde, right? You've got that in your slides, all the other words for formaldehyde, like formalin. So she ended up being diagnosed with an autoimmune disease because she also had peripheral neuropathy, so numbness and tingling all over her body. She became anemic. Remember, solvents damage the bone marrow. Joint and muscle pain. She had fever. She flushed. She was weak. She lost her period, and she was very fatigued. And they also experienced, the physicians that saw her exposed her to cold and observed Raynaud's phenomenon, which is a lack of circulation in the fingers and toes. She did have evidence of autoimmune disease. For the healthcare providers in the audience, she had elevated ANA, elevated anti-neuronal antibodies, reduced complement, and that was how she got the diagnosis of autoimmune disease. Now, in 2011, this was September 2010, in 2011, she started getting plasmapheresis, which is a removal of the blood, taking out the plasma, putting the red cells back in, white cells back in, and some albumin back in order to keep her autoimmune disease under control. Now, this is obviously a bad case, right? but it allows you to see how formaldehyde works as a sensitizing agent and how it induces autoimmune disease. Now, remember, the only test we have for formaldehyde is an antibody test called antibodies for formaldehyde against human albumin. Albumin is the main protein that's floating around in your bloodstream, carries a lot of hormones, really important, can't live without it. So the formaldehyde joins to the albumin and you make antibodies against yourself, right? And that's the problem with formaldehyde. This is known, it's been known forever, conventional medicine. Formaldehyde induces autoimmune disease. So, as you can probably imagine, it's really bad to have antibodies to formaldehyde. Now, my antibodies to formaldehyde came about pretty innocently. When I was in medical school, I had a job working as a medical researcher. Back in those days, a long time ago, we actually went to the medical library, got the books off the shelf, opened them up, turned them upside down, put them on the Xerox machine, and Xeroxed off the pages. That's how we got the information. What was happening, which happens with ink printers, inkjet printers in your house or at your job, is that that ink, which contains formaldehyde, is being slapped on the pages. Then, when I was in college, I actually had another job where I was exposed to a business next door to our business that printed T-shirts. So lots and lots of ink, lots of printing, lots of formaldehyde. Years went by, and I noticed that when I was in certain environments, I would get very sick. And in fact, I do have antibodies to formaldehyde. So I have to have an air filter in my house, but also just be very aware of where I am, what my exposures are, because that's an antibody that my body, that's an image, a memory that my body will keep. Now, you asked a really intelligent question, Stacy, about the mechanisms for how this all happens. There are thousands of mechanisms, literally, for autoimmunity, and they're not the classical ones. This patient that we just reviewed had ANA levels. It is common for patients to have elevated ANA levels. I will tell you, 0% of the time when a patient comes in with elevated ANA, does their doctor say, wow, have you tested your home or work environment for formaldehyde? Never happens, just because doctors aren't educated about this. If they did and they could, I think we would see some very interesting relationships between probably indoor air, formaldehyde levels, and autoimmunity.
You mentioned you wanted Anne-Marie to speak about the formaldehyde.
The formaldehyde.
I want to make sure that we don't forget this, because it's a good piece to this puzzle. So I'm going to turn it over to her real quick.
Believe it or not, your personal care products also have formaldehyde in them. But because manufacturers of personal care products know that they can't use formaldehyde and list it on their ingredients, they use something called a formaldehyde preservative system, which are chemicals of varying names that are put into things like, Johnson & Johnson No Tears baby shampoo, believe it or not, which made my kids cry buckets. But, and they turn into formaldehyde over time, but you don't have to list it on the ingredient label because the beginning chemicals are not formaldehyde. They just, over time, they turn into formaldehyde. How elegant is that? Now, in the case of the Brazilian blowout, that was about 12% formaldehyde, and there were a lot of cases brought because salon workers and also people getting Brazilian blowouts were having a lot of problems with it. And so a new category was born of formaldehyde-free hair straighteners, only they're using things, again, that aren't, technically formaldehyde. But when you put them in the hair and you apply heat, you're going to get formaldehyde. The Environmental Working Group actually tested a few of these and found that they weren't as high in formaldehyde as Brazilian blowout, which brazenly, used a lot of formaldehyde, but there was between 2 and 5% formaldehyde in these formaldehyde-free hair straightening products. And so some of these ingredients they're like aldehydes and certain acids. And so the idea is that if there's a product, think about it. Formaldehyde is used in clothes to make them not wrinkle, and they're used in hair to make it very straight. If you've got a product that claims to be a hair straightener, it's best to be suspicious of that, maybe not containing it at the outset, but when you apply heat to it, creating a formaldehyde situation. And formaldehyde, in addition to all of the things that Dr. Patrick just said, is an incredible skin sensitizer. And the American Contact Dermatitis Society every year picks a winner on the strongest and best sensitizer known to man. And in 2015, it was formaldehyde. It was formaldehyde. So it totally has that reputation as a sensitizer to the skin and body.
Okay. We've talked so much already, especially about, formaldehyde. And Lynn, earlier you touched on the Bob Navio approach and theory. I don't know if there's more that you want to touch on regarding the cell danger response. We talked a lot about it the other day.
Sure.
Yes, we should mention the cell danger response.
Yeah, absolutely. So Dr. Robert Navio, UC Irvine, I think, isn't he, Anne-Marie? He's a
UCSD.
UCSD, sorry. He has formulated a theory called the cell danger response as a result of his incredibly broad and deep research in the area of environmental toxicant exposure. And what he's found is that if there is, let's call it a sensitizing or inciting response, that the cells sense literally, and I know we're being anthropomorphic here, saying that cells are scared, but oh well, we're going to do it, that the cells sense as danger. It has a profound effect on how the cell actually functions. In essence, the cell shuts down. The mitochondria, which is the powerhouse of the cell, everybody knows, right? The mitochondria stop actually producing ATP. Now, I don't want to go into the nitty-gritty of the cell danger response, but let's just assume that Dr. Navio's theory, whenever the cell senses danger, as the cell continues to sense danger, this same response continues. And the reason that this is important is because the clinical application of the cell danger response is that you have to turn off the cell danger response in order for the human being to heal. And we know because of his research using a drug called Suramin, which turns off the cell danger response in autistic children, that he could reverse autism. Reverse it, right? He could heal autism. So he's a genius, honestly. And I think that he wrote a paper in 2020, very short paper. I believe it's in the slides, where he says very clearly, as long as the incitant, the thing, the chemical, the compound, the infection that has initiated the cell danger response, as long as it's there in the environment, you can't turn the cell danger response off unless you've got the drug called Suramin, which isn't available to us. So it really made me think when I read his paper in 2020 that this whole phenomenon that we're doing this to, called chemical intolerance, and presence of chemicals in our environment, as long as we refuse to acknowledge that, we'll continue to have patients who are chronically ill and chemically intolerant and don't get better.
I also want to add, this is another reason why people are so fatigued. They're so tired. They have to drink a lot of coffee or do energy drinks or do NAD or do methylene blue to resuscitate their mitochondria.
Yeah.
It's really mitochondrial damage, and we feel a better route is to address these environmental toxicants that are shutting down the mitochondria in the body, and then you just get back your own ATP energy.
Essentially, the mitochondria is being poisoned, as we talked about.
Yeah, that's the short version.
Yeah,
that's the direct
with all of these
Yeah.
toxins. It's so true, and
yeah.
boy, I will say one of the top, maybe the top reason people come to see doctors like us. One of the top reasons is fatigue. It's right up there. Fatigue.
Yeah, that's everybody. The energy drink business wouldn't be what it is today if people didn't have the fatigue they have all the time, right? Okay, unfortunately, I think we are all out of time for today. We had a lot of really, really good conversation today. So thank you everyone for joining us for day 2 of our webinar. And as you've heard, this isn't just about isolated cases. It's a global and growing challenge that affects everything from infection to chronic disease. So please, please, please join us again tomorrow, where we're going to shift gears a little bit and we're going to ask the question, now that we know the problem, what must we do? We'll explore the steps that must be taken to protect public health at large, but more importantly, how clinicians like you can lead the way. Whether it's educating patients, advocating for safer environments, or integrating detox protocols within your clinics, your role is more powerful than you think. So you're not going to want to miss this in day 3. Same time, same place. We'll see you then.